So this exercise we're about to show you is designed to help increase pec and lat extensibility as well as work on your thoracic rotation. So you need to be laying on your side. I want you to bring your knees up as close as you can to your chest. The reason why we do this is we want to flex up the lumbar spine so it does not participate in this movement. So from here, what I ask people to typically do is hold on to their knees with their arm that's on the ground. Your other arm that's on the ground. There you go. Perfect. So from here, I want you to bring your right arm up, bend your elbow to 90 degrees, and we want your elbow up a little higher than your shoulder. We want to keep that arm bent to about 90. We're going to take a breath in through your nose, exhale out, and as you exhale, think about letting that shoulder blade drop towards the floor. Again, breath in through your nose, exhale out. Allow yourself to open on those exhales and focus on the shoulder blade moving. Now it's important here, keep going for me, that you do not feel any pain in your shoulder. If you feel pain in your shoulder, we need to readjust and fix something. Often people allow their elbow to drift down below their shoulder, and it starts to put their shoulder in a compromised position. So it's important you keep that elbow up higher than the shoulder. If you're feeling any pain in your lower back, we need to stop. You should not be feeling this in your lower back. You need to bring your knees up closer to your chest if you are. It's okay if you're feeling a little stretch in the outside of that top hip. Really what you should be feeling is your upper back stretching and rotating, and really your pec, so your chest muscle, and your lat, so kind of running down the back of your armpit area, stretching out with this, okay? Have people do about 2 sets of 5 breaths here. So following a good thoracic rotation mobility exercise, I like to do something that requires some active thoracic rotation. So what we're going to do here, I have my clients or patients start on hands and knees. I ask them to sit their butt back all the way to their heels or as far as they can, and I want them to drop one elbow in between their knees. So one elbow in between their knees. The reason why we do this, again, we want to lock out the lumbar spine into flexion so it does not participate in this movement. Now with your other hand, we're going to place it behind your head or your neck. Perfect. From here, I want you to rotate up to the right and try to look at the ceiling, and then come back down. We're going to try somewhere between 5 to 10 reps here. Again, we're trying to rotate up through your thoracic spine, feel your shoulder blades engage as you rotate up. Now she's doing a nice job of not drifting, so if I show her from the front, she's not rotating or side leaning too far out to the left here. Should be a straight rotation, almost like I put a dowel straight down her spine. She's doing a nice job here. Okay, let's try switching over to the other side. So elbow drops on the floor, hand behind your head or your neck, rotating up. And it's going to be a little bit more difficult after doing that other side. That's normal. Well, same idea, somewhere between 5 to 10 reps. I like to use this to follow up any type of thoracic mobility exercise you did prior to this.